we've had a number of questions submitted from members of our community that they would like to ask, and one of them, because it's come up here, talks about thoughts in terms of taking disease-modifying therapies with the diet, in terms of your thoughts.
I think people can, they'll make their own decision as to what they want to do. Okay. If you're already on disease-modifying therapies, as soon as you stop disease-modifying therapies, you're going to increase the probability of relapse. Mm-hmm. No one has compared if you stop disease-modifying therapy, but you've fully implemented diet and lifestyle program, how much overlap is needed or not. We don't have any research studies to guide that. Okay. When I teach in my seminars, my recommendation is that you have at least 6 months to 2 years, so we don't know what that time frame is, of great effect, very excellent response using diet and lifestyle, great clinical response, and then you could wean things off. But what people often succumb to is, I'm doing great. It's been a year or two. I want to have some of that birthday cake. Yep. And they begin to not be as vigilant on their diet and lifestyle. Mm-hmm. So what they're doing is they're stopping their disease-modifying therapy when they quit being as vigilant on diet and lifestyle. Okay. So it's a complicated question. I think people have to decide and work with their personal physicians what is best for them. I certainly would not abruptly stop the disease-modifying therapies. Okay. And how long do you need to see great effect? That's an unknown. It's an area that I certainly would like to study.
Okay, and there's no limit to the sort of research studies that we could do here in terms of comparison things, right? Is that planned
yes.
in the future? I mean, one clinical trial at a time, but
no, it's one grant at a time. When I get back, I'm meeting with my study team, and we discuss study design ideas, and so we'll get that grant, and then we'll work on the next study design idea, and so you just keep, as you know,
sure.
One grant, then you start on the next grant, and you get to do the studies.
Never ends.
You get to do the studies that get funded.
Yeah. So one of the things with the current clinical trial, if I'm correct, it's just looking at people with relapsing remitting
yes.
MS.
Yes.
Either through anecdotal evidence or evidence that you have at the moment, maybe preliminary scientific evidence. Any insights into how this works for people with progressive MS? And again, is that
my original study was with progressive MS.
Okay. Yeah.
So it was with primary and secondary progressive MS, and we chose them because, well, one, that's the disease that I have, and we needed to copy my experience as closely as we could. And if we had any improvement, you would not expect it.
Yeah. Because
it was in the progressive phase of the illness. And the fact that we had such remarkable improvement in quality of life, reduction in fatigue, was remarkable. In that half of our folks had remarkable clinical improvement in gait, when you expect all of them to decline at least 25% per year, it was really quite remarkable.
Okay, fantastic. Now, I know that one of the questions that Kate was interested in, and sort of something that you just talked about before, and you might want to frame this yourself if you want, Kate, from off camera, was talking about the strictness of following the diet and what are the most important parts. Do you want to discuss that a little bit?
I think it's really important, and you've alluded to some of the things, Dr. Wahls. It's really difficult for a lot of people to embrace wholeheartedly something where they're not going to expect an overnight effect in their health. And there may be all sorts of restrictions, like financial restrictions, or even people who live in supported situations where they have limited control. So for those of us who choose or who are unable to embrace everything about the diet that you recommend, what would you list as the priorities for those who want to dabble?
So I have many things to say about this. In my clinical practice at the VA, I would take care of people with a wide variety of health problems, autoimmune, mental health, typical internal medicine stuff, obesity, traumatic brain injury, and we'd encourage them to embrace the protocol, and they may decide, like, no, that's I'm not ready, and we just send them to the dietitian, and they would improve the quality of their diet at the pace that they're willing to do so. If they came to work with me in the group, the commitment was, at the very least, gluten-free, lots of vegetables, and then would help them sort out if they're a meat eater or not, and depending on their diagnosis, we might be a little more restrictive on the diet. In the people that I was taking care of, these were folks who were impoverished because of their disability status, and I was part of the VA hospital, which is basically a charity hospital. So people were not eating organic. They were just doing the best that they could. And we could see very dramatic results. Now, certainly, the more fully you can embrace the whole program that I talk about, be it the diet, the lifestyle, the more fully you can embrace organic, yes, you'll recover more rapidly. I'll also make the observation that there's a huge difference between being 100% gluten-free all the time and being sort of mostly gluten-free. Because if you keep eating foods to which you have an immune response, you'll maintain those elevated cytokines. You'll maintain the activated microglia in your brain. You'll maintain neuroinflammation. And so you won't know how much improvement you could experience if you had really embraced the 100%. If you have a traumatic brain injury, you may still get benefit from more vegetables, but you may have gotten a whole lot further had you been willing to do this 100%. So in my clinics, we would give people the option of working with a dietitian to improve the quality of their diet as well as they could. Or if they wanted to work with us in our group clinics, then the commitment was 100% for 100 days, gluten-free, more vegetables. Mm-hmm. That was the bottom line. And if they weren't ready, if it wasn't the time that they're ready to do that, that was fine. We just sent them to the dietitian to work at the pace they were willing to work. Yeah. We have many, many epidemiologic studies that show more vegetables is associated with lower rates of heart disease, cancer, cardiovascular disease, obesity, diabetes, mental health, and autoimmunity in general. Mm-hmm. So even that very simple change, it can be very helpful.
And I think this brings up an important point, and I talk a little bit about this when I give talks in terms of people who ask about how do we do this and how do we work, what's going to work for us, because not necessarily everything's going to work to the same extent for different people. We know that with MS in particular, people have very variable responses. And I talk to them about if you're going to try and do this, you want to try and make it as scientific as possible in terms of your own experiences. Try and do it in a way that you can work out when you make a change. Monitor, is this having any benefits for me? You would obviously be in a much better position to comment on that than I am. Do you have any advice for people?
I talk about this in my book. A couple tools I suggest. One is that you do a journal, and you identify what is the symptom I'm trying to treat, what's the intervention that I'm going to use, how long am I going to try this intervention, and then make a commitment that, am I ready to do this 100% or not? If I'm not, you might as well wait and pick a different intervention that you'll do 100%. Yeah. And I'm very fond of 100 days, 100% for the intervention that you try. Journaling is very helpful. In my book I talk about some tools such as the medical symptoms questionnaire that gives a numeric scoring system. I would also check in with a family member, a very close friend who can also rate you on how things are going for you. Sometimes they have more insights than we have.
First of all, your recovery story truly inspired me because I saw someone who definitely had bad disease and who recovered as compared to someone who may never have developed bad disease and who may or may not have made a difference with whatever they took on board. I particularly love the fact that you didn't tell me if I followed what you said I would get better. And some of the other people gave me that impression, which left me with a sense of any ill health I had was completely my fault, rather than, my inability to be perfect in my dietary choices was to blame for any ill health I had. Whereas you, to my eyes anyway, were open about the fact that you tried multiple modalities to get better, and you did get better, but you didn't claim to have some divine knowledge of what contributed what and what would work for someone else. And I found that so reassuring because I felt like you were a partner, that you wanted to help me, but you didn't promise you knew everything about me. And that, I don't know, it was kind of a journey reading your stuff and thinking some of this really resonates. So I'm not anywhere near as strict as I understand you are with my diet, but I've totally embraced what I saw as the concept of improving my nutritional density of the foods I eat and trying to avoid things that I would see as active toxins after reading what you wrote about them. And I'm, as you can see, really well today.
And what we have to do is keep reading widely, think deeply, be willing to try stuff, and pay deep attention to our response. And like, well, that experiment worked well, I'm feeling better, or, well, no, this experiment is not working out so well, and I'm going to not continue that particular intervention.
Mm.
Because your journey will be different than mine, it'll be different than Tara's, it'll be different than everyone else's. And you have to trust that.
Yeah. And I guess trust is what I felt I had in the person writing your book, whereas I hadn't quite felt that with any of the other books.
Yeah, and I'm also cognizant that as soon as I think I have all the answers, I'm full of shit. And I'm really wrong, because knowledge and insights will always continue to evolve, and there's enough genetic variability that the solution will be different for each person.
Okay. So in terms of looking at how things are having an effect, one of the questions that we got from our community members, from Nigel, was, I'll just go through what he said here. I've been wondering about the lesions that are found on MRI and how they are given importance in MS. The lesion appears to be a secondary event, which also appears not to be the reason we have disability. Mm-hmm. Can you please ask Dr. Terry Wahls her view on what is happening regarding the primary cause of disability, and if she agrees that lesion counting or that focus on lesion timing is not a true indication of what is occurring, that diet and stress management are having positive outcomes which are not seen on MRI.
So on MRIs, we now have the ability to measure brain volume at a very precise level. So originally we just counted lesions and lesion load, number of new inflammatory lesions, and that was a criteria used to approve drugs because it was fast and easy. We thought that'd be a nice association for predictive disability. But it turns out brain volume is much better predictive. In the speed of brain volume loss is 2 to 3 times as fast in people with MS than the normal aging process. And there's also the understanding that inflammation comes and goes, does not predict time to wheelchair, bedridden, or demented state, but brain volume loss does. My interpretation of brain volume loss is this is a mitochondrial event, inability to generate enough ATP for the neurons. And so the drugs can turn off inflammation very well, but they're not very good at dealing with mitochondrial dysfunction. Yeah. Diet and lifestyle are far more effective. Okay. And there are some interesting studies. Lipoic acid, which is a supplement targeting of the mitochondria, was very effective at decreasing brain volume loss. We have some data that we've not yet published on our brain volume changes, and I'll look forward to hopefully being able to get that out in the coming year.
Okay, we will stay tuned.
I'll let you know when I get to talk about that. It'll
definitely. So Nigel had a few questions, and we'll make sure we try and get through as many as we can. So one of the questions he was asking in terms of the differences between different dietary interventions that are out there, one of the big differences is in terms of saturated fats.
Yes.
Do you want to talk about that?
Yes, sure can. The other diets that are out there, McDougall, Swank, Mediterranean, Wahls, then the government funded studies. I'm the only one that has said, so what does the basic science say that brains need? What does the basic science say that mitochondria need? And how does my diet do at delivering those things? I'm the only one that has taken the time to design a diet and then tested it to see if the food rules provide those nutrients. And so these other diets may provide that or may not. No one's really measured that. In the study that I'm doing now, comparing the low saturated fat diet as described by Swank and the Wahls diet, we are measuring what people are eating beforehand and what they eat afterhand and what's happened with the nutrients. So we'll be able to comment on that. I did look back at the change in saturated fat intake in the Wahls diet, and when people implement the Wahls diet, the saturated fat content does go down, by the way. Trans fat markedly goes down. Fiber content markedly goes up. Nutrient density markedly goes up. Mm-hmm. It'll be really interesting to see how that compares to what we see with the Swank group. It might be similar, it might be different.
Okay. So there's some questions now that's come through from Andrew. One of the questions was about eggs, and,
Yeah.
and your thoughts on eggs in terms of whether or not they can be.
So the reason I have people come off eggs, if you look at the literature, the most common unrecognized food sensitivity is gluten, the protein in grain. In the amino acid sequence in grain is very similar to the amino acid sequence in casein, the protein in dairy. And there's some other reasons why dairy is a problem. Now the third most common protein that can be inflammatory is the egg protein. So particularly, there's some nice literature on that in terms of inflammatory bowel disease, asthma, eczema, I believe psoriasis. I know for myself, I'm also very, very sensitive to eggs. So my advice is take the eggs out, 100 days, and then you can reintroduce them if you want. But you won't know until you take them fully out.
Yeah. Okay, fantastic. One of the questions we got from Elfrida, this is a big question. What do you believe causes MS? I get asked that question all the time as well.
So
you could have
there are many things that cause MS. It's an interaction of genetic vulnerability. Right now there are about 300 different genes that increase your risk ever so slightly. And it's this complicated interaction then with my genes and my lifetime of food choices, my lifetime of physical activity, my lifetime of toxin exposures, my lifetime of microbial exposures, my social networks, and all of that comes together. And then I begin to develop my symptoms. And then a decade or two later, I finally get diagnosed. So I can take drugs to turn off inflammation, or I can do everything that I possibly can to address all those environmental factors and see how much remyelination capability I have in my brain. And in my case, apparently quite a bit.
Yeah. Thank you so much for your time today and answering all of the questions. And we've got some more questions, and I'm sure over the future, as Terry's going on with all the clinical trials, we'll be able to get you on board again
of course, I'd love to
answer more of these questions and provide updates on what's going. As a final statement, do you have a thing that you'd love to say to our community in terms of your work and things that they can be doing?
I'd certainly encourage them to follow what I'm doing. See me at terrywahls.com. I don't know when you're showing this, that people have the chance to go to drterrywahlslive.com. They'll learn about the event here in Melbourne and Sydney. And we've had folks from Australia come over to see us in our seminar, which is a remarkable experience as well. So follow along, learn more, and then I'll let you know when my next round of papers come out so I can come back and chat some more.
Excellent, and be engaged, I guess, is the other key message that we've got. Be active in terms of pushing
Do everything that you can. You don't need your neurologist to approve eating vegetables. I don't think you need your neurologist to approve learning how to meditate. But you can ask your primary care doc for a physical therapy referral.
Okay. All right, fantastic. Thanks, everyone. Thank you again for your time. Have a great time while you're here in Australia. Melbourne's turned on some nice weather for you today. So
they certainly
enjoy
have.
that and have a great time with the events.
Thank you
so much. Thank you.